Thank you, Chair.
Yes, and because this is a health, that you put your mask, wear your mask properly. Thank you.
Thank you, Chair. My name is Solomon Kitungu. I am the Principal Secretary, State Department for Transport.
Good afternoon, everybody. My name is Felix Ateng, Director, Government Clearing Agency.
Good afternoon, Chairperson and honorable members. My name is Joe Mutugu. I'm Special Advisor to CS James Masharia.
Is that all?
That's the entire group from our ministry.
Okay. CS Health?
Thank you very much, Madam Chair, and the rest of the members of the committee and friends of the committee. My name is Mutahi Kagwe, Cabinet Secretary for Health. I've also been accompanied by a number of colleagues from the Ministry of Health. And with your indulgence again, Madam Chair, I would like to ask them to introduce themselves. Maybe starting from my back right here. Kombe.
Thank you, Madam Chair and Cabinet Secretary for Health, Mr. Mutahi Kagwe. My name is Professor Yeri Kombe. I'm the CEO of Kenya Medical Research Institute. Thank you.
Good afternoon. My name is Rose Mudibo, Director Liaison, MOH.
Good afternoon. My name is Anne Nganga, working at the Ministry of Health in the COVID-19 Health Emergency Response Project. Thank you.
Good afternoon. My name is Dr. John Keiro. I'm in charge of national testing as the head of National Laboratory Services.
Good afternoon, Chair of the Committee, Cabinet Secretary. My name is Dr. Nduku Kilonzo from the Ministry of Health. Thank you.
Did I see the PS walk in?
Yes, thank you, Chair, honorable members. My name is Susan Mochache, the Principal Secretary in the Ministry of Health.
Thank you very much. Honorable members and our guests this afternoon, which is both the Ministry of Transport and Ministry of Health. I request that we start with the Ministry of Transport. Last week, just as a background, we received on our investigations on the usage of COVID funds and the donations that were received from various donors. From the submission of KEMSA, they give a submission that they were not involved in the clearing of Jack Ma Foundation donations, and they referred to...
Madam Chair, maybe first things before we go to, with your kind permission though.
Honorable Jagawa?
Yes, I was just wondering, we made the invitations, or Parliament made invitations to the two CSs, both Transport and Health.
Yes.
And the accounting officers. Maybe we would need to know why the CS Transport is not here. I heard Chris Obure, CS, say that you might know, or you know that he's not here.
Okay, maybe when the CAS was doing the introduction, you didn't really get him. I am in receipt, members, from a letter addressed to our clerk, Mr. Michael CLI, by the Cabinet Secretary, Transport, and he has given his apologies for not making to attend. If you want, I read the letter, I can read it out for members, and also requested us to allow the CAS, Honorable Christopher Bure, to represent the ministry on this important meeting.
Madam Chair, how does that sit with the Speaker's ruling? Sometimes early this year that the CSs should come in person and not send their cars.
The ruling was that there was no, the ruling, the Speaker's ruling was if there is an emergency or a meeting that the CS is not able to come, with this letter we can be able to listen to the CAS. If there is any other matter that we may need to follow up with the CS, I'm very sure the committee can make the decision after, Honorable Jagagwa. But we can proceed because he didn't just appear. I think he made an explanation, and I'm also in the receipt of this letter. And it's actually a regret. He said, I regret that I will be unable to attend the meeting, and therefore request that you allow the Chief Administrative Officer in my office, Honorable Christopher Bure, AGH, to represent me at this important meeting, and signed by the Cabinet Secretary. So if you're okay with that, members, I would wish we proceed then. Honorable Jagagwa, are you okay?
Shall we proceed?
Thank you. So I was giving a background that during last week's submission of KEMSA, there was an indication that KEMSA was not involved at all with clearing of the Jack Ma Foundation donation that were given to this country. And the submission was that the Ministry of Transport was involved in receiving, and KEMSA only acted on the instruction to just store and the distribution from the ministry. So I'd like to start with the Ministry of Transport, just to tell us the role that the ministry played in clearing the Jack Ma Foundation COVID-19 supplies, and how the Ministry of Transport handed over the shipment to the Ministry of Health, and what was actually handed over. So I'll ask the CAS to proceed.
Yeah, thank you very much, Honorable Chair. First, I want to start by clarifying that my Cabinet Secretary is always committed and has always attended invitations to both houses of this Parliament. Unfortunately, on this occasion, he was not feeling well, and that's why he's not able to join us. Honorable Chair, we've been asked to come here and explain the role played by the Ministry of Transport in clearing the Jack Ma's Foundation COVID-19 supplies donation. That's question one. Question two, how and when the Ministry of Transport handed over the shipment to the Ministry of Health? And I wish to respond as follows. By way of background, the Republic of Kenya, through the Ministry of Health, received donations and medical supplies from the Jack Ma Foundation as part of its efforts to combat the COVID-19 pandemic. These donations comprised testing kits, personal protective equipment, and other medical supplies. The donations to Kenya were part of a larger donation to Africa that was originally received in Addis Ababa, Ethiopia, from where it was distributed to other African countries. All the Jack Ma Foundation COVID-19 donations were consigned through the African Union, Addis Ababa, Ethiopia. In response to the particular question, number one, on the role played by the Ministry of Transport in clearing the Jack Ma Foundation COVID-19 donation, the Ministry of Transport's role was limited to providing clearing services through the Government Clearing Agency, which was domiciled in the Ministry of Transport until 11th of May this year, when it was transferred to the National Treasury through an executive order. All the Jack Ma Foundation's donations were cleared exclusively by the Government Clearing Agency. Ground handling and storage services were provided by Kenya Airways, a licensed ground handler, as further described in my response to the second question, which I will deal with in a moment. Madam Chair, in response to the query on how and when the Ministry of Transport handed over the shipment to the Ministry of Health, the donations arrived at Jomo Kenyatta International Airport on various dates, as indicated in the table which we provided, which has been provided to this response and which we provided to members. Upon arrival at Jomo Kenyatta International Airport, the licensed ground handler, Kenya Airways, moved the cargo from the aircraft to their bonded warehouse, after which the clearing process was undertaken by the government clearing agency prior to the release of the goods to the consignees indicated in the table below. The consignee verified that the details and the quantities of the goods received were consistent with the details in the airway bills. The table also contains details of the airway bill numbers, the description of the goods received, and the flight particulars. If you look at that table, airway bill number 071-369-96013. This is in respect to COVID-19 detection kits. This consignment arrived on the 24th of March, 2020, and was released on the same day to the Kenya Medical Research Institute. The flight which carried this consignment is Ethiopian Airlines flight number 318. It was collected from the Kenya Airways warehouse through a senior official of the Ministry of Health, Dr. Isabella Ayaga, who was the designated officer, Madam Chair, and was carried away in track registration number KAT 332X. The second consignment, conveyed through airway bill number 071-37-000-00084, was in respect to medical supplies. That consignment arrived on the 15th of April and was released on the same day, again, to the Kenya Medical Research Institute through the same officer, Dr. Isabella Ayaga, who was the designated officer for purposes of this consignment. This consignment was, in fact, loaded onto motor vehicle registration KBX 497X. Part of this consignment, I'm informed that there were few packages which were not delivered on that day, but were subsequently delivered on the 28th of May, 2020, under way bill 2668. Consignment 3 was conveyed through airway bill number 071-3701-9975, and this comprised laboratory supplies, kits, screening equipment, hospital care, and IPC material. This consignment arrived on the 22nd of May, 2020, and was released on the 24th of May, 2020. This consignment was for the Ministry of Health. It was conveyed through Ethiopian Airlines, flight 318. Again, the designated officer, Dr. Isabella Ayaga, received these and moved the equipment away through motor vehicle KBX 497X and GK 538G. The other equipment were detection kits, which arrived on the 20th of May 2020 through Airway Bill number 071 350 20583. This consignment was released on the 24th of May 2020 to the Kenya Medical Research Institute. Again, the flight carrying this was Ethiopian Airlines 8304. The designated officer, Dr. Isabella Ayaga, carried this equipment away in motor vehicle KBA 948T, KBR 948J, KCE 006S, and KCD 627X. The last consignment was brought in through Airway Bill number 071 3701 986. This consignment arrived on the 20th of May, was discharged, was released on 24th of May, again to the Ministry of Health through the designated officer, Dr. Isabella Ayaga. Thank you, Madam Chair.
Thank you very much, CS, and I hope the detailed report can be handed over to the members of the committee, because you seem to have information that you have read that is not on this summarized document and would wish to have. My only question, it might be that it's in your other document. I've seen the COVID-19 detection kits, medical supplies, laboratory supplies, kits, screening, hospital care. Where are the PPEs? When did the PPEs arrive? Are they part of this, or would we be able to know the air bill number specifically? Because I can see detection kits are very clear, so would like to track the PPEs. And maybe it's in your other reports. I'm not so sure whether you're able to tell us which one. CS?
Yes, Madam Chair, we are able to track this through the Ministry of Health, who are the recipients, on behalf of KEMRI and on behalf of the ministry itself.
Yeah, so my question is, you see, you have given us clearly the date of arrival, date of release. So which one is it? Which batch or which air bill number is it?
Yeah.
Which air bill number is it? You know, we can see their detection kits. It's clear. So my assumption is it's number 3, but I don't want to assume. So I'd like we clearly know the PPEs. It's okay. Your people can be checking as I take a round of questions from members. Honorable Jagagwa, Honorable Owino, Honorable Joyce, and then Honorable Koros, Honorable Adagala. I think in that order.
Thank you very much, Madam Chair. The question was the CS to respond to questions on Jack Ma Foundation COVID supplies donation. My opinion is that the answer given is quite fake. At best, I would term it an escapist and not to the point. Honorable Obure, Chris, has very succinctly summarized what they did, summarized on this table, Madam Chair. But other than telling us that there was a airway bill number this 071 blah blah, description of the goods, COVID-19 detection kits, the date of arrival 24th, the date they were released 24th of March 2020, the flight that they came with, Ethiopia Airways, the 318, and they were handed over to Kemri. What were the quantities of these consignments? Because we were not here to investigate, just a paper trail of the flight that it came with. What were the specific quantities of these items that were delivered or donated by Jack Ma to the great people of the Republic of Kenya?
During my response, the representative of the Ministry of Health verified these items and confirmed that they were consistent. What she received was consistent with what was dispatched through Ethiopian Airlines. For example, on the first consignment, the quantity of the detection kit that was received and cleared were 11,300 kits. On the second waybill number, with details I gave, the consignment was 274 packages of various items of medical supplies. When it was received, when it was dispatched, they discovered that there was an excess of 12 packages. These 12 packages were subsequently received through waybill 2668.
Point of order, Chair.
What is out of order?
Yes, Chair. That's the information we wanted. Why is he keeping for himself that information?
Did you have copies, CS, of that information?
Yes, I will make available copies of this information.
Okay.
Because,
and then, excuse me, Chair. I think we have one of our friend of the committee who is not supposed to be sitting here. Our senior is supposed to be sitting there, not here. Because I'm asking a question, he's responding for them.
Order. And
I'm requesting
yes.
My senior honorable, my friend, I think you should be sitting there, not here.
No, Honorable Koros, let's, as colleagues, let's respect each other. And that is our grandfather in this parliament, so let's respect our senior.
Chair, can we get the
and
copies?
not get to the side shows. Let's go on. Honorable Koros, that's your grandfather, so
we get the copies,
allow him
Chair.
to sit freely where he wants to sit. And I ask the CS to proceed.
Yes.
And our senior, don't engage with the young ones again. You take your cool. Thank you.
Madam Chair, Honorable Kolos is an honorable member. He's not a young one.
Honorable Jagagwa, let's proceed. CS?
Yes.
Chair, can we get copies? I think that's what members really want.
Yes, that's where we were at before we got diverted. So you said you have copies?
Yes, I will make available those copies.
Okay. I'd wish that once you go through them, you table them, give them to our clerk, so that we can go through them.
Madam Chair, the third consignment was in respect to disposable gloves, masks, and so on. And this was in the form of 3 packages of 22, each weighing 22 kilograms. And this, as I said, was received on the 28th of May, 2020. The other consignment, Madam Chair, was in respect of assorted medical supplies, 697 packages. This was received and dispatched on the 24th of May 2020. However, on this consignment, 21 packages were short-landed, 21 packages. And up to this moment, this has not been accounted for by Ethiopian Airlines. But the rest of the packages arrived safely. And I want to confirm, Madam Chair, that all these items arrived safely and they were dispatched following proper verification by the designated officer. And at this point, maybe I will request the director, first of all, the principal secretary, Solomon Kitungu, if he wishes to clarify any of these, following which, with your permission, I will request the director of the government clearing agency, maybe because these are the people who handled them on the ground, to say, with your permission.
That's in order. Proceed, PS.
Thank you, Chair. Chair, we came with the director for government clearing agency who actually dealt with the matter so that he could provide any further details.
So who is the director? Proceed. I think you've heard the concern from members, and it's clear what information they want to get. So would you just be very clear on what you received, the process, and how you handed over, whether to KEMRI directly or to the Ministry of Health? Did you hear me?
I didn't get that.
Yeah,
Thank
proceed.
you, Madam Chair. Yeah. As you heard...
Order, Chair. Point of order, Chair.
What is it, Honorable Koros?
Can he first introduce himself, Madam Chair?
It's okay, he's just headed there. You know, not everybody is used to this getting inside these chambers. That's why I had to ask him whether he heard me. So, Director, introduce yourself, what you do for the government, and handle the issue.
Thank you, Madam Chair. My name is Felix Ateng, Director, Government Clearing Agency.
And
now
also, could you also properly wear your mask?
Yes, I'm Director, Government Clearing Agency.
Put up your mask so that it covers your nose. Thank you.
This is an organization that was formed with an objective of facilitating the government in clearing and forwarding of anything that it exports or exports. As clearly stated by the CS, these consignments arrived.
And speak to your microphone so that we don't struggle to hear what you're saying.
They arrived in 6 batches. And the first consignment, as was mentioned, arrived on 24th March. And there were detection kits, 11,300. And Ministry of Health designated an officer by the name Dr. Isabella Ayaga, who is the head of global health security at the ministry. So she's the one who we were coordinating with when clearing these consignments. So the first consignment was received by an officer that she directed called Vitali Shikulu from KEMSA, and was transported by KEMSA trucks on the same day. The second consignment...
I think, I don't know whether I'm the only one who is lost. Director, we might need to give you some time.
Yeah.
Because that information you are giving us is what we are looking for.
Chair.
But clearly what you gave
Madam
us
Chair,
here...
Madam Chair, let me add my voice on
order,
this.
Order, just let me
Madam
just...
Chair,
yeah.
will you allow me to add on my voice?
Honorable Koros,
Thank you,
Just
Chair.
hold on.
Chair.
Hold on. Vice Chair.
Waziri Chris, you have a lot of experience when it comes to Parliament. I guess so. And going with the document that you have tabled here, and even the document that you are reading there, is not the same. And then two, the Director of Government Clearing has more information, which the Ministry should have harmonized and tabled as a whole in the committee.
Point of order,
Now,
Chair. Honorable Koros, could you allow
Now.
your colleague to finish? Then I'll give you a chance.
Will I say that you are not prepared enough to appear before the committee, and perhaps you need enough time to go and harmonize what you have, and perhaps be given more time to table that document here? I think that will sort out this issue.
Thank you, Vice Chair. I think that's what I was raising, because you seem to have information that we don't have. For example, you said the first bunch. You actually added it was 11,300 detention keys received by Dr. Ayaga, then who received a KEMSA. That's the information we're asking for. I don't know, you seem to have other papers that you're referring to down there. Maybe what you can do is we give you time. You go compile those many papers that you have, give us as a report with attachments. So that it can, what you are saying is what we are looking for, but we are struggling to hear you. You're not very audible. And number two, that's information that we would want to have, but it's not in our document.
Chair.
Honorable Koros.
Yes, Chair. That's why Chair was saying what Waziri was giving us was fake. I request, Chair, I request this committee. I think what the director is telling us is the truth. What the ministry is giving us is fake.
No,
and that's
Honorable
why,
Koros will
Chair,
not go through
we
that
always
that
request
way.
when we have
Order.
such kind of a national issue which Kenyans want to know the truth. It's always good when we have...
Who is the head of global health security at the ministry. So she's the one who we were coordinating with when clearing these consignments. So the first consignment was received by an officer that she directed called Vitali Shikulu from KEMSA, and was transported by KEMSA trucks on the same day. The second consignment...
I think, I don't know whether I'm the only one who is lost. Director, we might need to give you some time.
Yeah.
Because that information you are giving us is what we are looking for.
Chair.
But clearly what you gave
Madam
us
Chair,
here...
Madam Chair, let me add my voice on this.
Order, just let me
Madam
just...
Chair, will
yeah.
you allow me to add on my voice?
Honorable Koros.
Thank you,
Just
Chair.
hold
Madam
on.
Chair.
Hold on. Vice Chair.
Waziri Chris, you have a lot of experience when it comes to Parliament. I guess so. And going with the document that you have tabled here, and even the document that you are reading there, is not the same. And then two, the Director of Government Clearing has more information, which the ministry should have harmonized and tabled as a whole in the committee.
Point of order, Chair.
Honorable Koros, could you allow
Now.
your colleague to finish? Then I'll give you a chance.
Will I say that you are not prepared enough to appear before the committee, and perhaps you need enough time to go and harmonize what you have, and perhaps be given more time to table that document here? I think that will sort out this issue.
Thank you, Vice Chair. I think that's what I was raising, because you seem to have information that we don't have. For example, you said the first bunch. You actually added, it was 11,300 detention keys received by Dr. Ayaga, then who received a KEMSA. That's the information we're asking for. I don't know, you seem to have other papers that you're referring to down there. Maybe what you can do is we give you time. You go compile those many papers that you have, give us as a report with attachments. So that it can, what you are saying is what we are looking for, but we are struggling to hear you. You're not very audible. And number two, that's information that we would want to have, but it's not in our document.
Chair.
Honorable Koros.
Yes, Chair. That's why Chair was saying what Waziri was giving us was fake. I request, Chair, I request this committee. I think what the director is telling us is the truth. What the ministry is giving us is fake.
No,
and that's why, Chair, we always request when we have such kind of a national issue which Kenyans want to know the truth, it's always good when we have.
My point is not about the CAS or anybody, or not about the director's position or anything else. It is about why the CS is not here. If this has been discussed, then I will need to get updated on. But why is the CAS here? If we can remember, the Health Committee has clearly put forward, and it has gone to the House and the Speaker. Yes.
Let me just inform you that we had already dispensed that matter. There's a letter already with us. And so it's only that you came in a little bit late. We had already handled the matter.
But tomorrow he must be here. It's another day. He must be here because the last time we discussed, even in this House, by the Speaker, and the ruling that was given, we want to see the CS coming here. CS Macharia must be here. We are not going to condone issues of, and avoiding this important parliamentary committee that is equivalent under Article 125 of the Constitution of Kenya, puts this House as equivalent to a High Court. And it's not a joke. It's not a joke. Thank you, Chair.
Professor, I would also wish that Honorable Koros,
Chair.
You cannot order the chair. That's one thing. So
point of order, Chair.
You cannot order the chair, Honorable Koros. But I think, members, for us to proceed, because we also have the ministry to give us their direction.
Madam Chair, just one important issue that I want to pass across, and it should go on
Who is
record.
speaking now?
Madam Chair.
Yeah, please, let's speak through the chair so that we can have some order.
Madam Chair, let me put it very clear that, this issue of COVID-19, it's a very serious matter. That as a committee, we don't want to discuss this thing back and forth. I want to appeal to the government and to the executive that they fine-tune on their communication. This is the problem that we have. It could be not, perhaps maybe there is nothing that is going on about this issue of COVID. But when we have people from the executive coming with half-baked information, this is what creates tension and dotted line outside there. So I will appeal that any institution of government invited here, if they know that they are not prepared enough, they need to go back and prepare. So then we avoid all these gray areas. And I will appeal, and I'm sure I'm communicating to some people in the government. So then we have enough information. Public should be fed with enough information. Madam Chair, thank you.
Thank you very much. CS and your team, we've made a decision. Clearly, we need a better document. We'll give you time. You take leave. The information, the direction that the director was taking, that's what we need. If yes, you received, for example, this number of kids, how many were they? We just need full details. Who received, then at what point were they handed over, and to who? So that from there we'll pick it up so that we can connect the dots. So otherwise, when we have these gaps, people will keep on speculating. So thank you. We request you to leave now.
Chair,
and we'll see you at 9:30.
The CS must be here tomorrow, Chair. I want this ruling to be done on. The CS Macharia must be here. We're not going to accept CAS to come and stand up for him all the time that he's avoiding this committee. It is unacceptable. Do we want to call it impunity of the last order? We will not accept it. We will not accept into that. And I want every member of this committee to be able, Senate as well as the National Assembly, to take that with me and second everybody here. We want to see the CS. Why is he not here? We are not going to accept tomorrow that we will not be attending this meeting
Professor,
tomorrow until he is here. We will not accept it.
I'll rule you out of order, Professor. Because once we have documents communicated to this House, we also a House of Procedure. We cannot anticipate what will happen tomorrow. Order, members.
Chair.
We are allowing the ministry team to leave so that we can proceed. So, Ministry of Transport, kindly take leave.
Madam Chair, for
We'll communicate to the Speaker on this matter.
For record, Madam Chair.
Yes.
I did inform the House, report to the House earlier, that the CS has a commitment, and he always attends parliamentary committee meetings wherever he is required. But I said on this occasion, he is indisposed. And I'm saying, you have asked us to come back tomorrow. We will stress to the CS on the need for himself to come personally, if he is well enough.
Point of order, Madam Chair, allow me. Is it now, if I'm sure you have a role to play. That's why you are a CS and you are appointed. Whoever appointed you, His Excellency, must have seen your capacity. For you to come to the committee and pass back the issue to the CS that he can be invited, it means you want to cast aspersion on your own commitment or that capacity to dispense government policy in Parliament. Do you want to challenge your capacity? I thought you are here on your own capacity. You've been sent by your boss to come and the reason why you are his assistant, it means you have that capacity.
Madam Chair.
Chris, I know you have the experience. You should not panic.
Madam Chair.
Now, I don't know why we are having this argument.
We
have ordered ministry. I think you need more time to go prepare yourself, give us facts.
Madam Chair, permit me to weigh in on this, please. Kindly, Madam Chair. We are not arguing. What I hear the members say, and I'm certain you've heard them, and the CS has heard. What he has said is very simple. He's going to place on the CS to attend tomorrow if he's in a position.
Yes.
It's as simple as that.
Yes.
But we need to place it in home that if the CS is unwell, we pray for his quick recovery so that he comes and faces this team tomorrow.
But honorable members, I also want to remind you,
thank you,
Honorable Jagagwa, that the last sitting, it's always good to be fair. The last sitting we had, the CS Transport came and appeared. And I don't think we have ever invited him and he has ever failed to come. There is a proper document forwarded to the clerk's office. So if there is a reason, all of us, anybody can be sick, anybody can have a commitment. So I don't think we need to really belabor on that point. We have directed the ministry. The most important point here, your document is not adequate. Go and prepare. Let's meet tomorrow at 9:30. Thank you. Let's go to the Ministry of Health.
Thank you very much indeed, Madam Chair. Madam Chair, could I just start by saying that indeed I am aware that my colleague is ill-disposed and would have loved to be here himself because I personally spoke to him on my way here, wanting to know whether he is coming, and I'm aware that he is ill-disposed. So I think it's good also to clarify that and to clear that it is not, he did not leave, he did not come here intentionally. And I would like to clarify that. He wanted to rest the case with my friend, Sheikh.
Thank you, CS. Thank you.
Madam Chair, let me start from the outset by saying that I am here to clarify a number of things that have been raised both by Parliament, and by Parliament I mean both houses, and issues that have also arisen in the public mind as a result of the communication that has been going on in regards to COVID-19 in general and specific issues that have been raised that involve matters of transparency, matters of management, and matters of accountability. From the outset, Madam Chair, let me say that when it comes to matters of accountability and matters of transparency, my ministry is determined that this is going to be the case. We are determined to clear every single item and every single issue that may be in doubt as far as this committee is concerned, this House is concerned, and the Kenyan people, because it is only fair and right that they do so. We have no intentions of protecting anybody. We have no intentions of hiding anything. And Madam Chair, I will do my best to clarify any issue at all that may have a reason between the time I was here and give specific details and the time and this time round. And just to say, Madam Chair, that it is important for this to happen. You have rightly said yourself that what happens is that when there are gaps, then you'll find that people will make up, or creativity will intervene. And that creativity, while important and good, is also important to clear, because it plays around with people's reputations, it plays around with people's names, and so on, and people's careers. And especially at this time, when this disease is still ravaging us, it is still continuing, day in, day out. COVID-19 as a virus is not finished. It is not a past tense. It's a present tense. Today, we will be announcing some people who have got the disease, and tomorrow we will be announcing others. God help us that tomorrow we will have no deaths and so on. But I think it is good to bring it to light that as we discuss these matters, let us not discuss COVID-19 as if it is over. It is here and present, and we will continue in the foreseeable future. And we pray to God that the people, that we do not lose any persons to this disease, as is currently happening both in Kenya and elsewhere in the world. So for me, Madam Chair, there are a number of issues that you have alluded to and have been asked to respond to. And what I propose is I will respond to the general questions. We have got the details of every single item that I'm going to mention. Every single thing I'm going to say has got an annex, a very detailed annex of what is included in it, and I'll be happy to respond to each one of those issues. Madam Chair, the first item I'm supposed to respond to by way of answer is the role played by the Ministry of Health in clearing Jack Ma's Foundation COVID-19 supplies, donation, and other donations. Madam Chair, let me just say this, that following what you have just heard, the clearance of any government donations is in the hands of the Ministry of Transport, as has been indicated. And indeed, we confirm that as the ministry itself has indicated, it is true that that's what we got. The general procedure of receiving donations in the ministry is through communication received from donors directly or through the Ministry of Foreign Affairs, informing the intention of donating commodities, equipment or services, and their quantities, when to be received, and the point of entry or delivery. The ministry then gets in touch with the government clearing agency, which is responsible for the clearance of government cargo, to confirm arrival and requirements for clearance. Once the commodities are cleared, they are transported to KEMSA or to KEMRI for storage and subsequent distribution. In regard to Jack Ma donations, the Ministry of Health received communication from the Ministry of Foreign Affairs for 3 consignments. Those 3 consignments are in Annex 1 of this document. The second Jack Ma Foundation donation came in 2 consignments. The first consignment was received from the government clearing agency on the 15th of April and cleared and delivered to KEMSA on the same day. Annex 3 of the document here spells exactly how that happened. And as Kas Obure had indicated, that is precisely what happened. The second consignment was received from the government clearing agency on the 28th of May 2020 and delivered to KEMSA on the same day. The details of the consignment are in Annex 4. The third Jack Ma Foundation donation was received on the 24th of May 2020 and delivered to KEMSA on the same day. That is Annex 5. In regards to local donations, the Ministry of Health was notified by donors on the intent, and continues, by the way, to be notified by donors who intend to support the fight against COVID-19, indicating what type of donations, quantities of donations, and sometimes the donors specifically indicate who they want to give their donations to, or what type of donations they believe are more useful than other times. And since this is a donation, we sometimes confer with them and agree. If a donor wants to donate to a specific county, we have no issues with it. We receive and take as they donate. Madam Chair, on the role of the Cabinet Secretary on KEMSA management and procurement of COVID-19 health products and technologies, Madam Chair, let me just respond as follows, and if you allow me, explain a little bit more. To say that the role of a Cabinet Secretary, not just Mutahi Kagwe, the role of a Cabinet Secretary is to provide policy and strategic guidance and leadership, in this specific case to KEMSA, but widely in the institutions under each ministry. Madam Chair, this is an important question that you raised, because it refers largely to some of the things that I have personally been verified for regarding my intervention or so-called interference with...
Chair, point of order, Chair.
What is out of order?
I request Wasiri not to clean himself here, because even as we have information, let him go direct to...
Honorable Koros,
Please,
you can also not gag him, allow him to speak, then you can make your judgment. I think we have called him here to express himself. Once he does so, it is for the committee to come up with a conclusion. So let's allow him to proceed. Proceed, CS.
Thank you, Madam Chair, for the protection. Madam Chair, may I be very clear that the role of a Cabinet Secretary in any institution is essentially to give guidance, is essential to provide leadership, and Madam Chair, all Cabinet Secretaries must at all times be in touch with the institutions which they run. Otherwise, what would they be doing? Madam Chair, in this instance regarding KEMSA, and in direct response to the question that you have asked, of course, Madam Chair, I have engaged KEMSA repeatedly especially over that COVID-19 period. And Madam Chair, it is my job to do so. It is my job to talk to the ministries. Madam Chair, as we speak right now, the Kemri boss is here with me. Last time I was here, we were with the chair of Kenyatta National Hospital. We consult. There is not a single CEO that I don't consult with continuously, because, Madam Chair, it is my job to communicate policy. It is my job to communicate strategy to the respective institutions that I have in my ministry. Madam Chair, in this specific case, for example, we were in a crisis. And Madam Chair, yes, we do not micromanage the institutions which we run. But we were in a crisis. And I can repeat, and I can give you examples of meetings that I had with the chair, with the CEO of that institution. I called in the people from Kemri, and the boss is here. I called in even lab technologists and technicians to discuss in a crisis where we knew nothing about. Which are the reagents that we need? Where do we get them from? What are the other items that we are going to need to fight COVID-19? And Madam Chair, it is easy to forget how the situation was at that time in March, when the whole world was dying away. In some instances, we are being told 1,000 people are dying per day. We are not ready. Everybody in the country is screaming for PPEs. It would be totally irresponsible for me to sit in my office and not ask my executives and not try to bring everybody together from KEMSA, the laboratories in Kemri, the laboratory in National Influenza Labs. I was bringing all these people together in settings so that we can be able to get a solution to a problem we knew nothing about, to a challenge we were not ready for. So, Madam, I also communicated directly to the CEO and gave government policy. For example, I am the one who gave direct policy that going forth, because of the high cost of PPEs globally at that time, we were able and zeroed in on local production of the same materials, which cut the cost, Madam Chair, from 9,000 shillings, which was the global prices at that time, to 4,300 shillings, a cut down of over 50%. Now, Madam Chair, it's my job to communicate to the CEO and to say to him, government has made a policy decision that going forward, we are not importing PPEs, we are going to buy them from local approved suppliers. And Madam Chair, that is my job. That's what I should do. So I am at a loss. I was at a bit of a loss when I'm told that I am giving directives or I'm trying to influence, I'm putting pressure. Madam Chair, I put pressure on each and every person in my ministry at that time. And in fact, Madam Chair, what I should do is apologize and thank them for the pressure in which they were working under. And I think it is important, Madam Chair, also to remember, there is an old saying in English, when the war gets very hot, even the generals go to the war front. And for me to sit in my office and do nothing would be totally irresponsible. And therefore, and I answer this question, not just in regards to KEMSA, but also in regards to other institutions, and indeed, in regards to government management. That's what we do. That's what my job is. And that's what I must continue to do if we are going to be successful in this fight. Madam Chair, if I may give another example. I have spoken. I mean, the CEO of Kemri is here. We have been with him around the country. We were with him in Kilifi to try and detail and talk to people there about the possibilities of working for a vaccine, for this, against this disease. And I have been with Kombe to Kilifi for the same. That's my job, Madam Chair. It is my job to put people under pressure so that they can produce the results we are looking for. It is, however, not my job to tell anybody to commit any crime. It is not my job to advise anybody against anything that they are not supposed to do. And in the event that I told a CEO to do something that is against the law or something they were uncomfortable with, the normal thing to do in government is to say, give me what you are telling me in writing.
Point of order.
It is out of order. That's Honorable Tongoyo.
Yeah, thank you, Madam Chair.
And take the opportunity to introduce yourself, and I can see you have a friend next to you whom I request to move to the next seat so that we keep social distance.
Okay, thank you, Madam Chair.
If you are seated somewhere that is not written, sit here. No, you are seated in the wrong place, then take another seat. Thank you. Proceed, Honorable Tongoyo.
Thank you, Madam Chair. Gabriel Tongoyo, MP, and a member of this committee. Madam Chair, from the list of questions that I asked to the CS to respond to, there are quite a number. And I think to respond to question 1, 2, and down, so that we probably come to the questions. He seems already to have jumped the gun, answering to what we even actually have not asked.
Thank you. I think CS be guided that you also summarize.
I am summarizing, Madam Chair, but the question is really quite clear. The role of the Cabinet Secretary on KEMSA's management and procurement of COVID-19 health products and technologies. Madam, that's what I'm trying to expound on.
Yeah, but you're already asking, actually answering like accusation. I'm sure you are referring to a question, or something that was raised in Senate, that you instructed, you kind of forced the procurement processes. So we have not reached that, maybe. I don't know.
Madam Chair, if I may summarize on the answer to the question, I think the other role that we played and we continue to play on COVID-19 is this. Madam Chair, as we speak right now, we have a crisis. We have a crisis because we do not have reagents. The American government has blocked or has suspended the exportation of reagents for testing our people. Madam, it's my job right now to liaise with KEMSA, and I indeed spoke to them yesterday. What could we do? What is it we can be? How can we salvage the situation that we have got right now in terms of shortage of reagents? And right now we get reagents from anywhere. We'll buy them, provided it is the reagents that we have. So, by way of summary, Madam Chair, I just wanted to expound on that because it's an issue that has been in minds of Kenyans and it's been raised. Continuing on and moving on, the other question is, when did the Ministry of Health receive the consignments of donations from the Ministry of Transport? And I would like to clarify that and indeed confirm that it is very close to what was said by my colleague when he was responding, that the ministry received 3 consignments from the government clearing agency, Ministry of Transport, as follows. The Jack Ma donations on the 24th, first Jack Ma donation consignments, 24th of March, second Jack Ma donations, 15th, second one on the same, the second Jack Ma were received in 2 consignments, the first one on the 15th and the second one on the 28th. And the third Jack Ma consignment was received on the 24th of May 2020. And then question 4, I'm supposed to give an itemized detail of the consignment. And Madam Chair, the Ministry of Health, through the Ministry of Foreign Affairs, received a note verbal with an attached packing list detailing the contents of the nation as explained in this document that you have, Annex 7. Madam Chair, on the issue of the status of medical supplies, and in particular, the personal protective equipment in the country at the moment. Madam Chair, the provision of the PPEs is a continuous exercise in COVID-19. And I would also like to clarify here, Madam Chair, that the PPE is an essential commodity in medical care, not just for COVID-19, but even for other conditions and other infectious diseases that we have. The only issue, of course, is that the speed at which we are using the current PPEs is very, very high. And Madam Chair, I think it is important for us to highlight to everybody, and to the committee in particular, that the biggest problem with these PPEs is that they are essentially not reusable. It's an item that costs 4,300, used once and disposed. And then we have got to get another one. And in fact, Madam Chair, if I may inform the committee, the exercise that is, some of the exercise going on now is to try and see whether we can be able to find ways and means of reusing some of these PPEs. But we cannot do so to risk doctors and nurses. We can only do so once they have proved that, that what I'm asking them is possible. And the demand, Madam Chair, will continue to be high for as long as the current nature of the disease continues. The PPEs in health facilities and communities have been availed by the Ministry of Health through procurement by KEMSA and supplemented by donations, as explained in this document in Annex 8. But there are also other sources, including procurement by county governments themselves, both from KEMSA and direct procurements from other sources, as we agreed, and the President waived the issue of procuring from KEMSA so that they can also buy from locally approved producers. But in addition, the COVID-19 Emergency Response Fund Board has distributed PPE kits to health facilities across the country. Using its capital fund, KEMSA procured also PPE kits, as was presented in their submission to this Committee of Health. I thank you, Madam Chair.
Thank you, CS. I'll give this to the members. We first take the first round, and then we can have the second presentation on the finances. Then we can see Honorable Koros, Honorable Joyce. That's Dr. Eseli, and as you introduce yourself, kindly, as you ask the question, introduce yourself, Professor Owino, and I'll finish with Tongoyo in that order.
Thank you, Chair. Thank you, Bwana Wasili.
And Honorable Koros.
Yes, Chair.
You know we are supposed to lead by example, so put. Thank you.
Thank you, Chair. Thank you, Bwana Wasiri. I have just one question, Madam Chair, to Honorable Waziri. Waziri, you said you didn't interfere or you don't interfere with your CEOs under your ministry. But kindly, Waziri, may I know what interest or relationship do you have with everywhere investment or distributors, the company which supplied KEMSA with BBEs?
Honorable Joyce.
Thank you, Chair. Thank you, Chair. While I appreciate the involvement of the CS and coordination of the sagas under him, and the constant regular consultation, I also want to appreciate the urgency that is usually expected in an emergency. Our main concern really was, in the last meeting, was when we were informed that a procurement of 738 million was done by KEMSA through a letter that was sent by the PS indicating the list of items, which was okay, but also the list of prices and the list of suppliers. And when we asked KEMSA whether that was procedural, because we were wondering whether the ministry did the procurement procedures, and I think KEMSA also confirmed to us that it was not procedural. So that is where we are coming from. And our second concern then, the other concern was a very large procurement by KEMSA of over 7 billion, apparently without consultation or maybe even approval, which I think the ministry will tell us whether that was the case, of items that we might even incur losses in price differences or even warehousing these supplies indefinitely. We were wondering what the ministry is also planning to do with these items. Thank you, Chair.
Thank you, and I'll request Honorable Joyce, you hold on the answer of that question, because the submission be from the ministry, I guess, covers, so you allow them to do their submission, and then I'll give you the first chance to interrogate the answer. Honorable Eseli.
Thank you, Chair. I'm Honorable Dr. Eseli Simiyu, MP for Tongaren. Bwana Waziri, there were some disturbing rumors that the Jack Ma donations were stolen, then sold back to KEMSA. Now, those were very disturbing rumors, especially if we are talking about a donor who has helped the country. I don't know if there was any truth in this, and if you know anything about that. Then lastly, I think, Bwana Waziri, you must be quite disturbed that KEMSA is holding stock worth 6 billion shillings, which was purchased at the height of the pandemic at very high prices, and now they're having difficulties selling them at the current prices, and it will result in a very serious loss to KEMSA.
Thank you. Prof.
Thank you very much, Chair. Thank you very much, Waziri and your team, for coming to present to the committee. I think exoneration is obviously one thing, and so that is acceptable, and that is obviously something that really needs to be done, both in public and in committee gatherings. So listening to spinners of unconfirmed information, or spiners, as some Kenyans accent use, listening to spinners of unconfirmed information must be known. We're not here because of the media reports or spinners or any other thing. Parliament is aware that everyone remains innocent until proven guilty, including all your staff and members and all that. So having said that, it is inferred to your guidance and obviously understanding that we want to know what efforts you have done to undertake a clear correction of the issue in place. And obviously, you are here, as you have mentioned, your role is to provide policy, strategic guidance and leadership to KEMSA and any other institution that comes under you, or any other saga that comes under you. Fair enough, that is quite understandable. But we want to know the efforts you have under to make clear correction on the wrongs that happened. And a declaration of that will obviously be a strength to exonerate anyone who might have been implicated on such matters. Have you had any communication? The second question is, have you had any communication from Jack Ma Foundation since the red flag has been raised, so that we know your competent approach to that matter suffices the responses required to such challenges? Those are my two questions. The previous one was to set the tone. Thank you.
Owino?
Thank you, Chair. First of all, let me thank CS and PS and the team. You have done a tremendous job. What this committee is trying to do is to have a clear statement to put the ministry where they should be and squarely where they should be. But Madam Chair, allow me a second to ask a question directly so that I can proceed with this, because if I don't get it that way, I will be stuck somewhere. So CS, is KEMSA a state corporation? Yes or no? Yes, it is. Is it governed by the State Corporation Act? Yes, it is. Now then, when we're looking at that Act of 2012, you as the CS, Part 4 of that corporation, Cap 446, says that state corporation and control of finances, every state corporation shall cause to be prepared and shall not later than the end of February every year submit to the minister and treasury for approval, number one, estimate of corporation's revenue and expenditure for the following financial year, accompanied by the proposals and project to be undertaken. That's really squarely falls in your docket. And that brings me to question, if KEMSA, out of their revenue, which we had requested, Chair, that we be given exactly the annual revenue in those 10% and whatever they make on their own, around 4 billion, and they go overboard to buy consignments, 7.2 billion. Doesn't it then occur that those should come to you because they were not in the previous budget? Maybe the Treasury is not aware of it, so that you can have some approval to it. Or is it just a corporation that is determining what they want and do what they want? The other statement, Chair, which is correct, in Section 15 of the same Act, and this is where you are alluding to, as we appreciate leadership, guidance, consultation, I think they were anchored on this. When it comes to accountability, then board shall be responsible for proper management of the affairs of the state corporation and shall be accountable for the money's financial business and management of the state corporation. That squarely fall on the board, and it is in the Act. That's why I acted in the first place. So that is what you are trying to say, that you are not micromanaging. But the other aspect, in fact, the same act says the CEO can only be called to ask questions, that the board makes a decision. But the annual estimates that comes must be approved. So did you get to know, or some kind of approval, that KEMSA was going to purchase 7.2 billion worth of goods? Lastly, as you know, CS, we are still in the quagmire of this disease. Nobody knows when it will weather off because of its mutation nature. We don't know whether it will mutate up or down, become aggressive and all that. We don't know. So we are still in the fight. But as we are fighting, these members of parliament will tell you, in our constituencies, the healthcare providers are still reusing masks. Some do not even have the masks. Some have the wrong ones. But KEMSA State Corporation is warehousing 0.2 billion worth of merchandise. Whether they are trying to make money of it, I don't know whether that is ethical practice or not. No. Now, you as the person at the helm, what do you direct? What do you guide? Because they were here and they said they need some authorities in order to dispose those. In times of pandemic, you may not care for making profit. And when you will be responding to that, tell us also about the 300 million masks. When you mention Chamber of Commerce, it's foreign to us. When we gave the money, we wanted masks to be given to the impoverished community. Right now, they have not even got it. It says here, this money was not meant for job creation. This money was an emergency. So you can also tell this committee what the Chamber of Commerce is doing in that arena. Thank you, Chair.
Thank you. We can finalize the first round with Honorable Tongoyo.
Thank you, Madam Chair, once again. Gabriel Tongoyo, MP Narok West. I've got just a few questions. One, I want to congratulate the CS for at least for the effort he has tried really, to combat this pandemic. And Bwana CS, when you came into this ministry, it's good to be fair, we saw a man full of commitment and energy. But just before you settled down, you made a personal confession that the ministry that you are heading is full of cartel, is a mafia house. And you really confess, even before the cameras. We want just to tell us, as you stand now, what is your fair assessment? How do you rate it? Another question, on matters of the PPs, and I think, Madam Chair, I ever said this before this committee. I happened to have been to one of the government facilities, and there was a whole container which purportedly was packed with the PPs. And to our surprise, I was there when it was overloaded. We found a whole container full with napkins. I don't know they were part of the PPs, but they are full of napkins. It was really very disappointing.
Honorable Tagoe, could you clarify full of what?
Napkins. I don't know, napkins are also part of the PPs.
What, Pampers or?
Pampers.
Okay.
Pampers.
Oh, I had monkeys.
Toto. So maybe they will tell us whether
I had full of monkeys.
They form part of the PPs. I had asked in the facility, they say yes, but it was not supposed to be those quantities. Maybe they will tell us more on this. Bwana CS, lastly, as the CEO in this ministry, do you normally make a follow-up of these items, donations, supplies, whether they really reach the designated facilities in this country? So, right? Lastly, I know this is one of a question that you really try to explain on your opening remarks. I think there was a big allegation from the KEMSA CEO in the Senate saying that you really kind of pushed them to disregard the procurement processes and procedures and award, the tenders against the procedures. And actually, I think he actually made the confession under the oath. So I don't know. You need to come up a little bit clear on this again, because I'm sure when the pandemic was declared, we had a little bit of some time, and any responsible CEO or manager will at least put in place. Responsible CEO or manager will at least put in place.
Because you bought something at 9,000 and you say that you cannot distribute it to counties unless they buy at 9,000. They will not buy them at 9,000. Take a hit, distribute these things, cut your losses, and then look at how to recover yourself from operational, from your operations, just like every other business in Kenya is going to have to do. On the issue of Honorable Eseli raised the issue of rumors about the stolen PPEs. On the issue of the price drop, I think I've addressed that particular issue. Now, Professor Sheikh, on the issue of what steps? Well, what have we done? And, Madam Chair, it's important for us to point this out, that we had two instances. A, we had our own internal audit go to KEMSA to try and find out what the issue was. And I'll tell you, Madam Chair, something that is probably not in the public domain. When we were sending our own auditors to go and look at KEMSA, we were not just sending them because of COVID-19. We were sending them to assess the issue of efficient management, because there is efficiency and there is matters corruption and matters efficiency. And we are looking at both. How efficient is our system? Because this followed some complaints, even from some of our donors who wanted documentation. They wanted documentation clarified. For example, if the Global Fund is giving us some money and they want communication to tell us, we gave you this money, therefore, please, can you please give us the accounting of that money, who you procured from, who you did, just like the World Bank I have just explained. And when they ask for those kind of things, you want to give them to them instantly. You want to give it to them immediately. And when that doesn't happen, they come to the ministry and say, we are giving you 40 billion shillings. Yes, we can see the items we are getting, but the accounting procedures are not right. So it is our responsibility. The second thing, Honorable Sheikh, through the chair, is that it is important for us also to know, and for you as a committee and the country to know, the investigations that are going on and have been going on, and the president, of course, said that they must be they must finish very quickly within the next 21 days from when he announced it. It is important for us to appreciate. We are the ones who actually, I am the one who invited these people to come and carry out those investigations. If we had something to hide, I would never have invited them. So I think it is good for us to appreciate. They did not come on their own volition. I personally spoke to the DCI and said, please come to the, not just, by the way, it is not just KEMSA. I said, even the ministry, come here and advise us. Where do you think the loopholes are? Where do you think everything is, things are going wrong? So it's at our invitation that they came. And if I had something to hide, all of the management that we have had something to hide, we would not. And it was in response to the same thing that has been asked by Mheshimiwa, that what is it? How now? What is the rating now between when I went there and what is happening now? Let me just put it this way. It is work in progress. We have made serious steps. We have transferred and mixed people. And I must say that the fact that a person has been transferred is not an indication of guilt. It is simply normal, efficient management transaction, so that we start anew in some areas. You know, some other transfers had been delayed for a long time. For example, a procurement person is supposed to be transferred 3 to 4 years. So when people have been there for 7, 9, 12 years, 30 years in some cases, then it is only fair that that be done. So yes, we are taking steps. We will continue to take those steps to create the efficiency required. But it's not just efficiency not to steal. That's not what we are trying to do. It is efficiency not to steal, but it's efficiency to be able to deliver healthcare to Kenyans. Because by the end of the day, in spite of all the discussions we are having, in spite of all the demands on us, the purpose of the ministry is to deliver affordable healthcare in time and efficiently. So the changes that we are making are also part of that. Because when you ask how do I rate it, I would say that it is work in progress, but we have made many steps in terms of creation of efficiency, in terms of a very good relationship with the county governments and county governors, because we cannot deliver universal health care unless we work with the counties. These are some of the gains that I would say that, that we have made. I think a lot of the issues that Honorable Owino raised in regards to the clarity of the relationship between our SAGAs, our prostators, our hospitals that run on their own, in terms of the boards and the role of the board that you rightly raised, Honorable Owino. I think it is important also for us to appreciate that policy communication, and when there is a crisis, as I said, procurement rules, there are very specific procurement rules. Emergency procurement rules allowed other emergencies, and these are carried out in the various organizations. And what happened at KEMSA, and I think this is what even the chair of the board said, is that they quickly formed a committee, a procurement committee, that can be able to fast-track those things in accordance with the state of affairs of the day. So at no time would I, as the CS in the ministry, propose to anybody that do not follow procurement rules. The procurement rules that you follow will be in response to the environment in which you are in at that time. So, for example, if you are procuring for something that is not an emergency, the procurement rules are clear. And at any time, the procurement authority knows exactly what is going on. And when you go wrong, then you don't go wrong because the CS told you to go wrong. You go wrong because you're a poor manager, and you don't know how to manage, and you don't know how to use the law in terms of procurement procedures. So that's a management issue. It's a micromanagement issue. What is the law regarding procurement? And I cannot go otherwise. And if any CS or any board chairman were to ask you to do anything that is not within the bounds of the law, then you must tell them, Bwana CS, this is not what the law says. Please give it to me in writing. If that is what you want, if you want me to break the law, give it to me in writing. And then we can take it up from there. So my job has never been, and will never be, to ask anybody to break the law, any saga, any organization that we are in, and I haven't. But so it is up to an individual. You know, Madam Chair, somebody cannot say that you told me, just by way of example, that somebody told me to go and steal Honorable Owino's coat. And I steal Honorable Owino's coat and say, you know, it is Jimmy Angwenyi, Honorable Jimmy Angwenyi, who told me to steal Honorable Owino's coat. Life is not like that, you know. There's no logic to it. So you cannot cry. Anyway, and I think Honorable Owino, the Madam Chair, through Honorable Owino through Madam Chair, what you said is absolutely correct.
Your microphone.
Yeah,
okay.
When it comes to the day-to-day management of an institution, you cannot go above a budget. Yes, you give us a budget. We'll approve the budget. We will then take the budget to, as you said very rightly, in February. In this particular case, as you recall, I went to the ministry at the end of February. But the point is that yes, that what you said is correct. A budget must be brought from every saga. Once the budget has been approved, it is taken to the Treasury. Following that approval of the broad operations of the organization and moving forward, what then happens is that the board approves things in accordance with that budget that has been given. In other words, if you go over budget, the only people who approve board budgets is the board. So if you go over budget without the board approval, then clearly you are swimming in your own wild waters. And from then on, you are actually personally responsible, for those situations. And that happens in all the boards in accordance with what you have yourself lightly pointed out. Now, just to finalize on the issue of the 300 million masks, I am aware that the chamber itself will come, but I think that what happened, Madam Chair, to Honorable, through the chair, is that the procedures for, and a decision was made between the government and, in fact, within the conference of the Council of Governors, that what we are going to do is that we are going to distribute the making of these masks to the counties, to and the most viable institution at that time was the chamber, so that they can go and distribute them, make them with their members in the various counties, and distribute them there. But I think what may have brought the delay is that KEBS also insisted that, yes, you are going to make these masks. Yes, we want tailors and other people to do, but they must also be approved by KEBS for use, for use by various individuals. So I apologize. I apologize for that delay. It should not have happened. And I think that KEMSA must fast-track that as quickly as possible, and the chamber must fast-track the making of the masks. Because, Madam Chair, it's also right, if we can, whenever we can, it is also right that we try and raise, and give people in the villages some sort of work, so that we are also addressing their plight, and we are also addressing the economic challenges. So, and that's why we have got all those things like Kazi Mutani and so on, is the mitigating that circumstance. As I finish, Madam Chair, I think that one of the issues that also came up is KEMSA and the 6.2, some issue on the 6.2 billion stock that they are currently holding. I think I also answered that question, that yes, they are holding some serious stocks of PPEs. We need those PPEs in the country, and I don't think that they have a choice except to look at it and sell it and be realistic about the current market prices. Waiting does not mitigate anything. I thank you and submit.
Thank you very much. Honorable members, I'll ask for indulgence. If you would allow the PS Muchache so that we can go through the figures, and then after that, then we can do the next intervention kindly, so that we...
I have questions for the Honorable Senator CS. Kindly, if you could allow me.
Is it something that can wait, then we ask all of them together? Honorable Jagagwa, kindly.
I might lose track when the PS comes. It will be another set of questions. I might lose track. Let us.
Sorry?
Madam Chair, the position on this matter is very simple. With your kind permission. In as much as we are constrained for time, this is a matter that has actually gained notoriety.
And I still ask you to wear your mask properly.
Thank you,
Thank
Madam
you.
Chair. So, in as much as we are constrained for time, this is a matter that has gained notoriety. So we need to give Kenyans all they deserve.
Proceed, Honorable Jagagwa.
Madam Chair, thank you. I'll make two statements and then ask three questions with your kind permission. One is to, because as we under Article 95, we speak for Kenyans, we speak for people. Some have approached us and some have approached me about the matters of reporting by our very good friends, members of the fourth estate. So kindly, as you take these reporting, as you make the reportings, make it as factual as it was. Let us avoid sensational reporting, because it might hurt careers. That is my first statement. The second statement, Madam Chair, is on under Article 227 of the Constitution, that each and single cent of the Kenyan taxpayer money must be prudently utilized. Now, permit me to ask my questions. We did set up, Honorable CS, we did set up a COVID emergency fund. I think you appeared before us under the delegated legislation, and we set up that fund sometimes in April. So my first question on that is, how much money, either in terms of government funding, in terms of donations, grants, how much money has gone into that kitty since it was set up? The reason I'm asking that question, and this brings me to my second question, I've seen a folder where you have elucidated the items that have been bought, where you have also, there are some correspondences from the CS Mochache, especially the letter of 15th April 2020, which we shall come to later. I've also seen a letter, some correspondence from Mr. Moredi, the commercial director. There are letters from Jonah Mwangi Manjari, the CEO KEMSA, literally seeking for money, literally begging for money from the ministry so as to pay off COVID-19 suppliers. So if there's money in that kitty, why are the suppliers not paid? My second question is that it's on the issue of masks. Bwana Waziri, you've been here, I think this is the third time on matters of COVID-19. And we have talked about the issue of masks. There's 300 million in the kitty. Masks have to be bought for the vulnerable members of this society. That has not been done. It's about 5 or 6 months since we got into the COVID era. The masks have not been bought. You have explained severally that there is an arrangement, or you're about to enter into an arrangement, or something is in the offing between the ministry and the Chamber of Commerce for the making of these masks. I'll let you know that as we are still grubbing on how the masks will be made, how they'll be distributed, Kenyans, those are vulnerable, still do not have the masks. So it's up to your office, it's up to your ministry to hasten that process. But of most pertinent, and which brings me now to my question, is that the chairman of Chamber of Commerce, Richard Ngatia, he is supposed to appear before us tomorrow morning, and I'm certain that is one of the questions that will arise. Unfortunately, his legal team has written a letter to this committee saying that they have a case pending in court and will not attend. What would be your comment on that matter? Now that the person who is in charge of the Chamber of Commerce, whom the ministry is entrusting to provide and make masks for Kenya, does not want to appear before this committee to explain about the masks, what would be your comment
Just for information, I'm well advised that letter has been withdrawn, and the Megascope, I think that was not on Chamber, it was on Megascope, that they still appear tomorrow. Just for information.
I stand guided, Madam Chair, but you see, when we come to discuss about Jack Ma and other issues, supplementary issues will come up. And now that the minister, our Waziri, Cabinet Secretary, this is the fourth or third time he's saying that the Chamber of Commerce is the one who is going to make the masks. But the gentleman, Richard Gatti, does not want to appear before us. Who shall we pose those questions to? Would need his clarification to confirm what the CS is saying. Because we have heard it severally from one party. So we need him here. So that is why I'm asking, what will be his comment? What is his comment that the chairman of the chamber does not want to appear before us? Honorable CS, my last question is that you've explained very well the role of our CS, giving guidance and policy directions to SAGAs, semi-autonomous organizations that are in his docket, or a docket for that matter. Letters have gone to and forth from the ministry to KEMSA, and one of that letters is the one of 15th April, where the CS, and I'm certain she'll explain herself out about the contents and the basis of that letter. But the bottom of that letter says, ignore all other communications on matters of this procurement and give to these companies. That aside, when KEMSA appeared before us last week, they gave us information. One was the companies that were procuring COVID-19 items for them. The list of directors, the status of the companies, that is CR12, a certificate from the Register of Companies showing who owns what company. Now that brings me to this question, Honorable Waziri. Now that you are giving policy directions to KEMSA, there is one particular company called Lego Freighters. It's a Mombasa company. Going by the CR, that is the list, the certificate from the Register of Companies. That letter, or that company, Lego Freighters, has two directors, Rashid Mohammed and Isa Aden. And Isa Aden. And Isa Aden. And Isa Aden.
Very much, honorable members and our guests this afternoon, which is both the Ministry of Transport and Ministry of Health. I request that we start with the Ministry of Transport. Last week, just as a background, we received on our investigations on the usage of COVID funds and the donations that were received from various donors. From the submission of KEMSA, they give a submission that they were not involved in the clearing of Jack Ma Foundation donations, and they referred to...
Madam Chair, maybe first things before we go to, with your kind permission though.
Honorable Jagawa?
Yes, I was just wondering, we made the invitations, or Parliament made invitations to the two CSs, both Transport and Health.
Yes.
And the accounting officers. Maybe we would need to know why the CS Transport is not here. I heard Chris Obure, CS, say that you might know, or you know that he's not here.
Okay, maybe when the CAS was doing the introduction, you didn't really get him. I am in receipt, members, from a letter addressed to our clerk, Mr. Michael CLI, by the Cabinet Secretary, Transport, and he has given his apologies for not making to attend. If you want, I read the letter, I can read it out for members, and also requested us to allow the CAS, Honorable Christopher Bure, to represent the ministry on this important meeting.
Madam Chair, how does that sit with the Speaker's ruling? Sometimes early this year that the CAS should come in person and not send their cars.
The ruling was that there was no, the ruling, the Speaker's ruling was if there is an emergency or a meeting that the CS is not able to come, with this letter we can be able to listen to the CAS. If there is any other matter that we may need to follow up with the CS, I'm very sure the committee can make the decision after, Honorable Jagagwa. But we can proceed because he didn't just appear. I think he made an explanation, and I'm also in the receipt of this letter. And it's actually a regret. He said, I regret that I will be unable to attend the meeting, and therefore request that you allow the Chief Administrative Officer in my office, Honorable Christopher Bure, EGH, to represent me at this important meeting, and signed by the Cabinet Secretary. So if you're okay with that, members, I would wish we proceed then. Honorable Jagagwa, are you okay?
Chair, we proceed.
Thank you. So I was giving a background that during last week's submission of KEMSA, there was an indication that KEMSA was not involved at all with clearing of the Jack Ma Foundation donation that were given to this country. And the submission was that the Ministry of Transport was involved in receiving, and KEMSA only acted on the instruction to just store and the distribution from the ministry. So I'd like to start with the Ministry of Transport, just to tell us the role that the ministry played in clearing the Jack Ma Foundation COVID-19